So our team has been on the road the last 2 weeks. We attended the Musculoskeletal New Ventures Conference in Memphis and then the North American Spine Society meeting in Denver. And between those two conferences, I bet we've heard from more than 70 companies. They've been talking about their new technologies and their strategies. And now we're back in our home offices. So let's do a bit of a debrief of just what we heard and who we spoke to.
Sure.
How about you go first? Yeah. What were some of the takeaways maybe in the companies that stood out to you at MNVC?
Yeah, so three quick trends. One of the first things I noticed as we worked our way through those presentations is about a quarter of the companies at the conference were sports medicine companies. And there seems like there's a real unmet need in sports medicine, specifically for older patients and female patients or people who might not have the best bone quality. There's that kind of middle age range where you're maybe a little too old for the traditional sports med stuff, a little too young for knee replacement. So a lot of companies are looking to fill that gap there in the continuum of care. Then enabling technologies and personalized implants. I think we all agree that these have a real place in the future of orthopedics. But I think a question is becoming, how do we scale those technologies to meet the exploding demand of the number of patients we'll see in orthopedics, but the relatively slow growth of the surgeon population? So several companies are looking for ways to scale those technologies to meet the demand that we all expect. And then finally, on the financial side, just the way the market, the global economy has developed over the last few years, companies should expect to exit far later than maybe they had in the past in orthopedics. From the folks that we heard from, it's probably you have to be commercial at this point unless you really stand out in terms of what you have technology, and then maybe 20 or 30 million in revenue before the strategics are really going to start to take a hard look at purchasing it. So those are the three trends. The three companies that really stood out to me first is Agada Medical. It's an analytics company that is really trying to help surgeons understand as they change their surgical plan, how does that impact the percentage chance of a good outcome? We've seen this through like ATEC spine. There's a demand in spine for this type of technology. So if Agada can really nail this, I think there's a huge space for them, not only in spine, but maybe across several segments. And of course, headed up by Dr. Lieberman, who brings a great pedigree from Mazor and everything that they've been able to do in the past. So definitely worth keeping an eye on. Happe Spine is another spine company that really stood out to me. They create a synthetic implant that looks and acts like a biologic. It also has potential applications far outside of spine, and uniquely among the companies that we heard from at MNVC, already generating revenue. So on that path towards commercialization that I just talked about. And then finally, ZKR Orthopedics. They create a little bit of a ramp implant to go under the patella tendon, to offload that tendon and reposition it to alleviate pain. And that could potentially delay total knee replacement 10 to 15 years. Again, filling that gap in the continuum of care for those middle-aged patients. So those are the three that stood out to me for sure.
Great. Thank you. Thank you for that insight. Certainly enabling technology and personalized procedures and personalized implants is, we see that across the spectrum, right? Across all segments in orthopedics. And it was absolutely a topic that, we heard about when we were at NASS as well. So I attended a few education sessions where surgeons did speak about advancements in robotics, and of course they mentioned minimally invasive surgery and just the shift of procedures from the hospital to the ASC settings. And I think those are all overlaps probably with your comments about sports medicine as well. So those trends, that the surgeons were talking about, they really aligned with what we heard from industry in the exhibit hall. So at NASS, noticeably, the large spine companies took up a much smaller footprint on the floor. Some of them didn't even exhibit at all. And I think that that provided a much different dynamic for this year's conference than in past years. So when I think about three companies, or I thought about three companies to talk about, I'm going to discuss three of the smaller companies, startup companies, and each of them is really capitalizing on a different market trend. So let's start with Therapeutics. Earlier this year, the company received FDA pre-market approval for its Pearl Matrix P15 peptide enhanced bone graft, and they actually began treating patients in July. Pearl Matrix is indicated for single-use TLIF in adult patients that have degenerative disc disease, and it's really the only, or it claims to be the first and only bone growth product that is proven to accelerate lumbar fusion. We know that right spine still suffers from a lack of fusion rate, so there's significant revisions, and really Therapeutics is trying to make sure that that patients just get to fusion much faster. So the Aspire study that they did, the full results are going to be published here, likely by the end of November. But Therapeutics noted that the study found patients achieved statistically superior fusion speed at 24 months, which was more than twice as many patients fused at 6 months versus local autograft. So certainly look forward to seeing more of those results as they really ramp up their launch in 2026. From the enabling technology side, I'll say that See All AI, it's the new company from Eric Major, who previously founded K2M, and Gene Gregerson, who was the inventor of the O-arm. See All, they probably win the award for the flashiest booth and the most interest at NASS this year. They're really tapping into the thousands of fluoroscopy systems that are already in use around the world. So their technology is being paired with fluoroscopy systems. They have a camera and an AI computing software that will create 3D images and navigation solutions. So this system requires no direct line of sight between their proprietary visible light cameras and then the patient's anatomy. And they're providing surgeons with 3D visualizations of the patient's internal anatomy without the need to create an open exposure. So their goal is to really enhance navigation efficiency, and ideally not just in the US, but around the world with this sleeker system, again, that taps into fluoroscopy systems that are already in use. And then the third company that I would mention is Demetra. Demetra's spine business was just stood up earlier this year. The company has made multiple acquisitions, including Get Set Surgical and Ortho Fundamentals, with the aim of really tapping into the US ASC market. Their model is single-use sterile packed implants and instrument kits, and they seek to really, again, tap into spine surgeons as well as interventional pain management physicians who own their ASCs or are running ASCs, and those surgeons that are focused on not only achieving good outcomes, but also are, very cost conscious of, the overall spend in the healthcare system. So Demetra, it's a European company. They also own Tecris and Osartis, and they've been able to really build out a portfolio that also includes orthobiologics. And they said, they're following all of the trends. They're closely looking at the MIS space, and there will likely be more acquisitions to come. But again, I think that was one company that was, really focused on the eventual move of procedures to the ASC market.
Nice.
Yeah. Anything else you'd like to add?
Yeah, I just maybe a little off topic, but I did notice this as we were listening to these pitches at MNVC. Over the past few years, you'll often hear actual investors give advice to the pitching companies.
Mm-hmm.
And it's really been focused recently on, show us that you understand the environment and the challenges that you're facing. I can see the allure of showing this explosive growth, saying that you're a platform technology that has application everywhere. We heard the term, it became comical how often we heard the term game changer or holy grail of orthopedics.
Yes.
And I think it's just worth, if you're a startup pitching, to think long and hard about how you position your technology. Because as the investors have said, if one slide is suspect, we can potentially question your entire slide deck and your thought process. So I'll be interested as the space changes and is rewarding commercial companies, later stage companies. Will startups start to kind of adjust their pitching technique to account for some of these things? So it was very noticeable this year for sure.
Yeah, that's a great point. Thanks for sharing. I know you and I, again, we're still working through all of our notes, and we'll be writing multiple articles based on the conversations that we've had with CEOs at both of the conferences. So I would just say to anyone watching, thanks for watching, and continue to tune into orthoworld.com and bonezonepub.com for more updates on these interesting technologies as they evolve.
We have plenty more stuff coming your way, so make sure you subscribe to our YouTube channel and hit the notification bell so you know whenever we post a new video, including our year-end projections. So we'll see you on that.